Morning everybody, this is Danielle Belec and I thought I would film my daily basic floor practices, exercises for my left hip replacement and share them with you so that those who are going through or will be going through a hip replacement in the near future have some idea of what's coming for them. So I'm going to start lying on the floor. And there's just one chair exercise as well, and I may add a few things. So the basic exercises are as follows. Legs are extended, and this is something you can do in your bed. It's super easy. You'd probably be those who have already had a hip done who are doing this before they started the surgery. So you squeeze your buttocks gently, hold them for 5 or 10 seconds. And then release. And again, squeeze your buttocks, hold them for 5 or 10 seconds, and release. If for some reason you're uncomfortable fully extended at the knees, you can put a pillow under your knees, you can gently bend and flex your hip joints and put your feet on the floor. So don't feel like you have to get into a position that's uncomfortable. Take care of yourself. Again, you can squeeze from here. And you could also squeeze the buttocks from here, okay? The next one is to activate the muscles at the back of the legs called your hamstrings. So here, the knees can either be flexed by putting a small pillow underneath, or they can be flexed simply by bending your knees yourself. The idea is to push down into the heels, contract the glutes, and the knees will begin to extend, and you'll feel the muscles at the back of the legs. So a slight knee bend, nothing dramatic. Pushing down in the heels, squeezing the buttocks, and as you get better at it, you'll start to feel like your pelvis is slightly floating off the floor. If your lower back will let you in and your hip flexors. So if your lower back and hip flexors are tight, don't expect to have your pelvis elevate at all. Just feel the tightness at the back of the legs. Try to push both heels in evenly, which is always a really focused attention in order to be symmetrical on both sides of your body, especially when you're recovering from very severe surgery on one side. These exercises are good for everybody, really. Okay, so the next one is simply sliding your leg up and down. I have a fairly slippery mat. I'm going to do both legs. So if it isn't slippery, you can put socks on your feet and lie on the edge of a mat so your feet are on the floor, and then you can slide your feet up and down a wooden floor, for example. Sometimes rugs are stiff or sticky, so your feet don't slide. So you're thinking knee to the ceiling, heel to the sitting bone. So your sitting bones are just underneath the bottom of your pelvis, to which you sit when you are sitting in a chair. So they're not behind you, they're underneath you. So you're drawing the heel towards the sitting bone, and then you're drawing the heel, slide it away as if you're marking a line in the sand on the beach. So knee to sky, heel to sitting bone, and then just think massaging the sole of the foot and guiding the heel away. These are called leg slides in the work I do. They're very basic, but extremely important. Try to move on your exhale, so soften through the chest, through the ribs, through the abdomen. Float the kneecap to the sky, heel to sitting bone. Inhale deeply at the top. Exhale, let the weight of the thigh and hip land into your hip joint. Take your time. It's not about the number of reps or doing it unconsciously. Especially there's going to be some tension in your back post-surgery most of the time. So allow yourself to be conscious and caring of your whole body as you do one single movement. Okay? So the next one is abduction. So I'm going to do that with the leg that I haven't recently had surgery on. So the leg goes out to the side and back in, and out to the side and back in, and on this side, out to the side and back in. This was the one that hurt the most for me at the very beginning. This is day 5 post-surgery. I had my surgery done on November 11th, the anterior approach. And today is November 16th, so it's the 5th day after full-out surgery. And as you can see, I'm progressing well. So then the next one is standing on your own 2 feet. People call it bridge. I call it forward pelvic shift. You really want to practice just pressing the feet into the ground and then releasing. Then just press the right heel ball of the foot down, vertically down into the earth, not away from you towards the wall. Then find the side of your body. In my case, it's the left hip replacement foot. Really find the whole shape of the foot, like an imprint of my footprint into the sand, and press the shin bone and knee down into the ankle, into the heels, and eventually it's going to take you up. And if it's this high, it's this high. It doesn't matter about the height. The most important thing is that you're transferring the weight of your body onto your feet, which you're going to need to stand and walk. The muscles that do that activate in the hamstrings and glutes, glutes first, then hamstrings. And if you keep pressing, the idea is not to shove yourself up to here and take it into your rib cage, lumbar spine, and thoracic spine. It's an action from the hip joints, and you can hold 2, 3, 4, 5. As you notice, the thigh bones are lengthening towards the wall at an oblique angle, as if a plane was coming off a ramp, and the pylons of the shin bones are down into the floor. And then you release, let the sitting bones open and smile. We place the sacrum and pelvic bones onto the floor, so it's not about pushing your lower back into the ground and then grinding up like this. That's a movement from the lower back, and this is an action of the hip joint from flexion of the hip into hip extension. I'm going to just go on. This is my surgery leg, so I'm standing on my non-surgical leg at this point. As I go through my rehab, which is not today, I will be able to lift the right leg off and stand on my left leg. So that's more advanced, and I won't be doing that to myself today. Okay, and then leg slides really allow the thigh bone to sink back into the joint and to open and soften the front of the groin so that the hip flexors, the tie is deep up as the 11th and 12th vertebra, and the bottom of the rib cage all the way down across the pelvic bones over the pubis into the inner thigh. That's your deep iliopsoas muscle, then your quadriceps from your thighs to the front of your hips. So you've got this whole wash from your knee all the way up to where the bottom of the rib cage meets the lumbar spine, that are part of your hip flexors that make you walk through life, okay, which is why we've just had a hip replacement, so we can do that with ease. So when you take the legs out long, you're able to really feel like you're elongating that whole fabric of tissue from your waist, imagining your legs started way up at the top, all the way down really to the soles of your feet fascially. So there's a whole kinetic chain of soft tissue through the whole body that keeps you connected as a whole. So the other exercise is to activate your quadricep versus your hamstrings and glutes. It's very simple, and you just press gently into the pillow, less into the back of the knee than into the back of the thigh. So place the pillow a little above the back of your knee, press the back of the femoral bone, the thigh bone, into the mat, and then reach the heel away. You don't even think up to the ceiling. You're just elongating the back extensors of the hip in order to help the quadricep activate without resistance. So it's anchoring on an exhale, the back of the thigh bone, and thinking of reaching your Achilles heel up and pulling the patella, the kneecap up. Think about drawing like a string, drawing the muscles of the front of the thigh up, 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 up. And then release. Inhale, exhale, release the chest, your throat, your neck muscles, your abdomen. Anchor the bone of the back of the thigh down, reach the heel away from the sitting bones, and draw. Think of drawing the quadricep up the length of the front of the thigh bone. Okay, so that's strengthening your quadricep. The first exercise, squeezing the glutes, or strengthening your glute muscles, obviously. The second one is pressing the heels into the ground with a slight knee bend to activate equally. Feel that connection on both sides of your legs, the hamstrings and glutes. Leg slides to get the motion, the pelvic femoral motion between the hip joint, in the hip joint between this hip socket and the thigh bone, working, it's almost like a ratchet, okay? And building that range of motion back up and teaching the thigh to let you in, because this thigh muscle becomes very tight post-surgery. And this, of course, increases grounding through the feet, the strength of the glutes and hamstrings, eccentric stretch of the quads. And then the one with the pillow underneath the thigh towards the bottom of it strengthens the quadriceps. Okay, and then there's one more, and that involves sitting in a chair. And again, it's about your quadriceps. So I'm just going to gently get up here, put my glasses on, gingerly walk over here. So here you're pressing the back of the thigh into the table, just like you did into the pillow, and you're reaching your heel away and thinking of pulling the quadricep muscle out. So it's really elongating the joint, not jamming the shin bone into the knee, lengthening, creating space in your body to move rather than compression. So it's nice to remind your other side that has not had surgery that you still love it too. So press into the back of that thigh and start to strengthen that up too, because clearly you're not as active in these early days of rehabilitation as you would be otherwise. Okay, so I think that gives you an understanding between this video and the video from yesterday of the basic fundamental exercises that are given to you through the hospital upon leaving post-surgery for, whoops, I think I'm not quite in the screen, there you go. Upon leaving the hospital to go home with the standing exercises we did yesterday in the video, second video, and this is my third video post-surgery, giving you the basic exercises for the floor. So I hope that's helpful, and I'll see you again soon. Thank you for watching. If this is a useful exercise video, please feel free to share it with people that you think will be helped by the information. Okay, thanks kindly. Have a great day.